there isn't really much out there in the world about how to chart in hyper-specific clinical cases, because patients generally have such individualized care, right? Like, of course, like every patient has hypertension if you're in the geriatric community, but the combination of diagnoses and like just like the various kind of ways they can be uniquely expressed, it creates a situation where it's hard to have any kind of like templated real documentation or care that Medicare can present as like, do this way. And so, and of course, that also is based on clinical experience and expertise. Like clinicians are, of course, supposed to know how to handle like these various cases based on their background, education, and experience, and so on. But even though we do, of course, trust our clinicians with their knowledge and experience and understanding of how to treat patients, especially those that are very experienced, Medicare still has standards for payment. And so LCDs are their interpretation of those standards depending on the case. Now, this really comes in handy when you are working with ADRs. What is an ADR? An ADR is an additional documentation request. This can happen pretty much like as a prepayment review or a post-payment review, meaning you could build the claim and then an ADR is requested so that pretty much like someone from the MAC or a third-party contractor reads the case to determine if they're going to pay you. It can also happen where you've billed the case, you got paid, and now you get a list of charts or one specific chart that the MAC would like to see if you are kind of doing things the correct way. So when there are ADRs in question, it's hard to understand sometimes how to chart, because a lot of agencies feel like they're doing everything right. They're, justifying medical necessity. They're justifying their homebound status or their terminal illness. Their CTI certification of terminal illness is like everything's done properly, whatever. The agency may feel like they're doing everything right, and they may be surveyed on these charts, and these charts might be flawless in survey. And they might submit them for ADR and get a rejection from the ADR. And so this leaves a lot of agencies very confused about this process.